A brief introduction about theophylline. Theophylline has the structure similar to caffeine. This is the structure. It has a purine-like ring. And so then theophylline can be synthesized either by naturally from cocoa beans, and nowadays it can be synthesized synthetically. Theophylline is a bronchodilator, so it is used for COPD and asthma and other respiratory related disease. And this is the pharmacokinetic of theophylline. It has high bioavailability, and then 40% of theophylline will bind to the albumin, and it is metabolized majorly by hepatic metabolism, that is end-demethylation process. And lastly, theophylline majorly eliminated by urine, whether it is unchanged or in metabolite form. Theophylline has half-life of 5 to 8 hours.
Therapeutic serum level of theophylline are between 10 to 20 microgram per milliliter, and above 20 microgram per milliliter is considered as toxic serum level. There are three types of toxicity, which is chronic toxicity, acute overdose, and acute single overdose. And normally toxicity occur at lower theophylline level with chronic poisoning than with acute poisoning. The symptoms of toxicity, which include acute myocardial infarction, urinary retention in men with obstructive uropathy. There is also increase in serum level of calcium, creatine kinase, myoglobin, and leukocyte count. There is also decrease in serum of phosphate and magnesium. For the serum level more than 20 microgram per milliliter, it will associated with seizure, and this seizure is not effective with anti-convulsive therapy, but we have to treat fast in order to prevent the brain injury. And death also can be occur secondary to the cardiorespiratory arrest. For the acute overdose, there is less likely to be experienced and less likely to happen the seizure unless the concentration is more than 100 microgram per milliliter. For the acute single overdose, normally is a result from suicide attempt, accidental childhood injection, and therapeutic overdose. The concentration of serum will be between 90 to 100 microgram per milliliter. Symptoms of acute single overdose include vomit, tremor, tachycardia, metabolic effects such as hypokalemia and hypophosphatemia. Hypotension and seizure can also be occurs, and seizure may be delayed 12 to 16 hours or more due to the sustained release preparation. Mechanism of action of theophylline is similar with the mechanism of action of theophylline toxicity, but if the theophylline is used in excessive, then it will cause toxicity. The major mechanism of action of theophylline toxicity is the endogenous release of catecholamine, and this will cause the cardiovascular toxicity and metabolic toxicity. The second major mechanism of action of theophylline toxicity is the adenosine antagonism. The adenosine is responsible for the negative feedback to the heart in response to the sympathetic overstimulation. But if the blockade of adenosine receptor occur, it will lose the negative feedback to the heart in response to the sympathetic overstimulation. The third mechanism of action is the inhibition of phosphodiesterase, and this will lead to the inhibition of degradation of cyclic AMP. The last mechanism of action of theophylline toxicity is the increased intracellular calcium, and this will cause the increase in the force of contraction to the skeletal and cardiac muscle.
Now we talk about how to manage the toxicity after ingestion of theophylline. Acute ingestion of theophylline can be treated with gastric lavage. It is effective in removing the theophylline from the body. Whole bowel irrigation only used for sustained release preparation of theophylline. Hypertension can be treated with vasopressor or volume expansion, such as phenylephrine and norepinephrine. The serum potassium level must be monitored. If necessary, the potassium supplement must be given. Benzodiazepine and barbiturates are prescribed in case of convulsion for patients with theophylline toxicity. Upper gastrointestinal hemorrhage can occur due to theophylline-induced peptic ulceration. Proton pump inhibitor or histamine antagonist should be given, but avoid cimetidine because cimetidine can inhibit theophylline metabolism. Multiple doses of activated charcoal can reduce the theophylline toxicity by absorbing the theophylline. Thus, it will minimize the systemic absorption. Ventricular tachycardia caused by theophylline toxicity can be treated with beta blockers such as propranolol or esmolol. Hemodialysis, peritoneal dialysis, and hemoperfusion is carried out for cases of severe toxicity. This procedure is used when only the drug clearance is reduced. Lastly, it is important to establish area, breathing, and circulation.